Migraines are different from headaches.
And I typically use an acronym called PIN, P-I-N. And if there's photophobia or phonophobia, so if there's sensitivity to light or sound, if there's intractability, meaning it's going to be there for hours or days unless you do something, and if there's nausea, then it typically is a migraine or a migraine variant. Typically, it's required to have two out of those three positive. So if two of those three are present, it's a migraine. Plus, migraines are very debilitating. So they're moderate to severe pain. Oftentimes, when you get a migraine, you can't do anything. Can't go to work, can't go to school. You basically have to lay down in a quiet room.
There are treatments and medications specific for migraines compared to normal headaches.
I would say we have a pretty decent revolution in the treatment of migraines with the advent of the CGRP blockers. Those are typically an injection that you would do once a month, and it prevents the CGRP molecule from actually working. Those are what we call prophylactic. So those are something you do if you have migraines or headaches associated with migraines for more than 16 days a month. So most of the time you're having a headache, you can just prevent them. Sometimes patients take more of what we call the old school medicines. So you can take medicines that slow your system down, like beta blockers, that decrease your heart rate and they just decrease your whole system. We have a lot of membrane stabilizers like topiramate or Topamax that can help with migraines. And then amitriptyline is a neuropathic medicine that a lot of patients take at night to prevent them. Typically, when you have very few migraines, you wouldn't focus on taking a medicine every day to prevent them. You would take something like a triptan. Triptans work because they close the blood vessels down in the brain. So we know if the blood vessels aren't opening up from that chemical, if we can counteract that by closing them, they can decrease how long the migraine lasts for.
Genetic components also play a role in who gets migraines.
There is a genetic component. So we ask every patient, do you have any family members who have migraines? Do you have, did your mom or did your grandma? There's more of a predisposition to pass that through the female side. I would say that it doesn't really change our management, but it does clue us in, like, yes, this is a true migraine syndrome.